Hi everyone, these are few one markers from conservative dentistry and endodontics to help you ace your exams. Starting with the first question on H files. H files, also called the headstone files, are endodontic instruments used for cleaning and shaping the root canal, characterized by their spiral sharp-edged design, which cuts dentine more efficiently when withdrawn. Next are the thermal vitality tests. These tests involve applying hot or cold stimuli to a tooth to assess the pulp's sensory response, indicating its health status. A positive response suggests vital pulp, while no response indicates possible necrosis. Cavitation or acoustic streaming. Cavitation is defined as the growth and subsequent violent collapse of a small gas-filled pre-existing inhomogeneity in the bulk fluid, and acoustic streaming is defined as the generation of time-independent, steady unidirectional circulation of fluid in vicinity of a small vibrating object. If this is cumbersome to remember, you can write cavitation is the formation of vapor bubbles in a liquid caused by ultrasonic waves, while acoustic streaming is the steady flow of fluid induced by these ultrasonic waves, aiding in the cleaning of the root canal. Next is the sandwich technique. This technique involves layering of a glass ionomer cement base beneath a composite resin restoration to combine the benefits of both the materials. Define inlay and onlay. Inlay is an intracorneal restoration of cast alloy fabricated extraorally to accurately fit a prepared cavity into which it is cemented. And onlay is a combination of intracoronal and extracoronal cast restoration when one or more cusps are covered. It is fabricated extraorally and cemented into place. The difference between compressive strength and tensile strength. Compressive strength measures a material's ability to withstand crushing forces, while tensile strength measures its ability to resist stretching or pulling forces. Usage of a wedge. A wedge is used in conservative dentistry to achieve proper contact and contour during restorative procedures and to prevent overhangs by stabilizing the matrix band. Define class 6 cavity. It is a cavity located on the incisal edges of anterior teeth or cusp tips of posterior teeth. Next question is define tarnish and corrosion. Tarnish is defined as the surface discoloration on a metal due to a chemical reaction, whereas corrosion is the gradual deterioration of a metal by chemical or electrochemical reaction with its environment. Linear coefficient of thermal expansion value of tooth and amalgam. The value for tooth is 11 parts per million per degree Celsius and the value for amalgam is 22 to 28 parts per million per degree Celsius. The number of walls in a class 4 cavity. There are 4 walls typically involved in a class 4 cavity. These are the mesial, distal, facial and lingual walls. Next question is draw shape of access cavity preparation in maxillary first molar. The shape of the access cavity preparation for a maxillary first molar is typically a triangular outline, with the base of the triangle towards the buccal side and the apex pointing towards the palatal side. This shape allows for proper access to all the canals, which is mesiobuccal, distobuccal and palatal canal. Next question is to write the chemical formula of sodium hypochlorite, which is okay. Next question is to define endodontics. Endodontics is the branch of dentistry which deals with morphology, physiology, and pathology of human pulp and periradicular tissues. Next question is the use of spreader in root canal treatment. A spreader is used in RCT to vertically compact and adapt gutta-percha within the root canal space, ensuring a tight seal and preventing reinfection. Next question is to enumerate the type of posts used. Types of posts used in endodontics are prefabricated metal posts, custom cast metal posts, and fiber reinforced composite posts. Ingalls formula for working length determination. Working length, that is the distance from the reference point to the apex, is equal to tooth length minus 0.5 millimeters. Next question is to draw a cross section of an H file and a K file. H file has a tapered design with sharp cutting edges, and it is typically used for initial preparation and canal negotiation. K file, however, is less tapered compared to the H file. It is flexible and it is used for further canal exploration and preparation. What is Phoenix abscess? It is an acute inflammatory reaction superimposed on an existing asymptomatic apical periodontitis. Thank you for watching. If this video has helped you in any way, please subscribe to my YouTube channel. Stay tuned for further videos.